short video will help you to understand more about personalised asthma action plans and why it's so important that we use them with our patients. A personalised asthma action plan is an effective tool that our patients can use to help them manage their asthma effectively and to reduce the risk of having an asthma attack. Going through the action plan and discussing the key points with the patient can really help them to understand more about their asthma, and it's only by understanding it that they can really start to manage it effectively. We know from the findings of the National Review of Asthma Deaths that was published in May 2014 that so many people didn't know how to recognise the signs of an asthma attack, didn't know when their asthma was getting worse, and above all, didn't act appropriately or quickly enough. An asthma action plan can help you recognise very early on signs that your asthma is flaring up or deteriorating, and it will guide you and tell you exactly what to do so that you will stay safe. Bring in the asthma action plan at the beginning of the consultation instead of at the end of the consultation. Go through it with them, talk about all the key points, think about the things that are worrying them, that they want to talk about. It's really important that we address all the issues so that we know that when that patient leaves the room they have all the information they need to stay safe. So what does the Asthma Action Plan look like? Well, today I'm using the Asthma UK Asthma Action Plan. There are 3 sections on the plan. The first section will help the patient to understand what to do every day to stay well. It'll look at the medicines, and along with that you can look at inhaler technique and the device that they're using. We won't be covering those in this short session, but we will have follow-up short videos which will help guide you in inhaler technique. This second section of the action plan will help patients to understand what to do when their symptoms get worse. Very often, patients tell us that they don't want to burden busy doctors and nurses, but it's really important that they do understand that they need to get help and they need to get it quickly enough. This section will talk about simple measures that they can take, measures like increasing their blue reliever inhaler during that time while they are waiting for an urgent doctor's appointment. The last section of the action plan deals with how to recognise an asthma attack and what to do. It's really important that patients are able to recognise early enough signs that they are about to have an asthma attack and take appropriate action to keep themselves safe. As a nurse or a doctor, it's really reassuring to have that knowledge that the patient knows what to do before they leave your consultation room. When we're looking after patients with asthma, we must look at taking a concordant approach to the review, involving the patient's own personal goals. Going through the asthma action plan, we can think about the person's individual triggers and what tools they like to use to help to keep themselves well. Some patients might like to use peak flow as a way of recording their symptoms and their lung function. However, the guidelines recommend a symptom-based approach to the action plan, especially in children and young people. Adults might like to record the peak flow, in which case you can go through that during the consultation. To find out more information about asthma, you can contact Asthma UK on 0300 222 5800 to speak to an asthma specialist nurse, or alternatively visit their website at www.asthma.org.uk. To find out more about our asthma management courses, visit our website or contact us using the details on the screen. Thank you.